Okay, so this is the Reiki Jin Kei Do level 1 self-treatment. So the client is sitting comfortably in a chair with their hands palms up in their lap, and all of the directions that I'm going to be giving are for us as the practitioners. So we start out standing behind the person. Our hands are in a prayer position, and we start by silently saying our affirmation, doing this treatment for the highest good. I make no judgments, nor do I visualize an outcome. I trust that everything's working in divine order. And then I forgot to ask earlier, we always ask the first time we're working with this person, Dan, is it okay for me to use touch?
Sure.
Okay, so we have consent. If we don't, we can just do the whole treatment with hands about 1 inch or 2 off the body. So we place hands lightly on the shoulders to begin. And at this point, you would do your brief 6-point meditation. It's not going to be like 5 to 10 minutes like when you're doing it for your meditation practice. It might just be like 30 seconds where you're bringing awareness to your crown, third eye, throat, heart, and then down to your palms. And the chair treatment, the full treatment is usually like at least 25 minutes. You can certainly do longer. So you can think we're spending maybe about 2 minutes in each placement. The next placement is the crown. And when possible, moving your hands one at a time. It's just a more soothing experience for the person, less jarring than if you're rapidly moving both hands at once. So the hands are on the crown or just off the body if they prefer to not have touch. And your fingertips are pointing straight out ahead of you. Your eyes are open through the Reiki treatment. It usually helps you to feel more grounded. Sometimes people close their eyes during the treatment. They start to feel a little dizzy. It's like meditating standing can be a little strange. So I would just keep your eyes open and just look at the person. Take your hands about 1 inch or 2 off the body. Now we're going to treat the energy field like we did with the self-treatment. So you can either make small circles in either direction. You can make some expanding and contracting motions, and come back to touch. Next, we move to the ears. Hands are cupped over the ears. And we have minor chakras in the ears that are important because we receive a lot of information through sound. So we're treating the ears and the ear chakras. We can take our hands off the body a little bit, again, making those circular motions, and then coming back to touch. So for most of these hand placements, we really just go straight down the chakras after this point. So you can step to one side of the client, and you place, for the third eye, one hand on the back of their head and the other hand on their forehead. You can treat the energy field. And coming back to touch. Sometimes people will ask, how do they know that they've been in each hand placement for 2 or 3 minutes? Really, you could just look at a clock. Another thing is there are pieces of music you could find, including on YouTube. If you look up Reiki music with chimes, where every 3 minutes a little bell goes off, it's just part of the music, and that can let you know to move your hands. My teacher also has a really great recording of chair treatment that you can play while you're treating the person. So this is just a demo, but it'll be paced as a real treatment would. You can just be listening to that while you're treating the client. Now we move to the throat. So one hand is on the back of the neck, and remember, we don't want to touch the throat of another person. So you can just bring on sort of a choking response. So my hands are a few inches off the body in the energy field. Now we go to the heart chakra. So center of the chest, a little bit above the heart, and parallel on their upper back. When you get to, depending on the height of the person, usually when you start to get to the lower chakras, you will probably want to sit down so that you're as comfortable as the person receiving the treatment. So you could set this up before the treatment begins, where you have your chair next to the person's chair. So usually for me, when I get to the navel, this is a point where I want to be sitting down. One hand is on the mid back and you can just touch the chair. You don't have to move the person. The other hand, you can either touch the stomach, or if you don't really know the person that well, or if the person has expressed they don't want to be touched here, if it's somebody who's talked about having a trauma history, or just I'm getting a vibe that this isn't going to be okay, I'm just going to stay in the energy field. But otherwise it is okay to use touch. So this is kind of like solar plexus, navel area. And once we get below the physical navel, we're not going to use touch on the body. It's just too invasive. So when I get to the sacral chakra, my hands are a few inches off the body, above the lower abdomen, and the other hand is parallel on the back, and it's just touching the back of the chair. Root chakra, we have a couple of options. One is that you can place a hand under the seat of the chair, and the other hand is on top of the person's head, can touch their head. And this is nice because in addition to treating the root, sometimes the person can feel energy running up and down their spine. However, it's kind of a stretch, and depending how tall the person is and your height, it might be too much. It might get to be kind of tiring, or just doesn't feel accessible at all. And so in that case, you can use the alternate position, which is that one hand is over the base of the spine, like where the tailbone would be on the back of the chair. And the other hand is a few inches in front of the base of the spine, not touching. So we've gone down all of the chakras, and this is just a demo. Dan's totally awake. He's sitting up nice and straight. So hopefully you can see all of the hand placements. Sometimes when you're doing this as a full treatment, by the time we get to the mid body, maybe we're like 20 minutes in and this person is starting to fall asleep, right? And they're like kind of leaning forward. So your hands may not be moving all that much head dives as you move through these placements. That's totally fine. Now we're going to come around to the front to treat the knees. So try to stay in contact with the person if you can, not leaning into them, but just stay in contact so it's not like I'm all the way over here trying to be near this person. I'm sitting in front of them. Again, you can have your chair. If you feel comfortable sitting on the floor, you could do that as well. I'm a big fan of yoga blocks. So if you're comfortable sitting on those, I have those handy, or even just like a little step stool or something, or a pillow. Hands are treating the knees. And to treat the feet, you can either leave your hands here and just look at the person's feet, visualizing Reiki running down the legs to the feet, like we did with the self-treatment. Or if it's comfortable for you, you can sit on the floor and place your hands over the person's feet or ankles and just treat the feet that way. With the chair treatment, a lot of times people have shoes on, and you can just place your hands right over their shoes. They don't have to remove shoes. The next placement is not in the paper, but my teacher and her teacher do this, which is that we treat the hands in the palm chakra. So the person's hands are palms up, and I'm placing, if you can see, but I'm placing my hands over the client's hands. So this is nice. In addition to treating palm chakras and hands, we're forming a connection between our heart and the person's. This is a good time to look at the person. It's normal, especially when you're new to Reiki, to be kind of nervous about it, but we'll keep our focus, if we can, on this person, being able to have a connection with another individual. So it's not just me having a private meditation, I'm making a connection with another person. From here, I'm going to go back up to the shoulders. So taking your time, again, trying to stay in contact with them if you can. And coming back to the shoulders, take a breath. And at this point, you might return to a place that you've already been to that you just feel drawn to go back. Or maybe before we started the treatment, we didn't talk about this, but you can also ask the person kind of like, what brings you in for Reiki, or why do you want to try this? And sometimes people will mention something specific, like I'm trying to open my third eye, or I have a headache, or whatever it is. So we're going to go to that place or places that were requested or that we feel drawn to. So let's say we feel drawn to go back to the third eye, or that Dan requested that, and we can go back there now, spend a couple minutes here. Then we come back to the crown. Now, if this were a full treatment and we've been doing this together for maybe at least 20 minutes or so, the client may have fallen asleep. They might have just sort of dozed off a couple times or feel very relaxed. So we've been doing the same kind of touch throughout the treatment. And now we want to change it up a little bit to signal to them that it's time to like wake up. So I'm going to slowly brush down from the crown, down the tops of the shoulders and upper part of the arms, the upper back. We usually do this around 3 times. When we finished, you can either rub the shoulder, you can tap the top of the person's head. I like to take a moment to silently give thanks to the person for being able to be of service, or you can thank them out loud if it's not too weird. So thank you for letting me give you this treatment, thanking myself for showing up, and giving thanks for Reiki in my life. So this is the table treatment demo. So we begin with the client laying on their back, face up. And we come to sit behind the person to begin. Notice that most of the tables have like a detachable face cradle that we'll be using later on in the treatment. The treatment begins with us sitting behind the person. Again, you can do your affirmation, do your 6-point meditation. When you're ready to begin, you place your hands over the person's eyes. So the first hand placement is treating the eyes. And from here, move to the crown. You can place the hands one at a time on the top of their head. I'm actually just going to turn the camera a little bit because I want to make sure you can see me okay. We'll move it later. So the heels of my hands are touching. And that can start to feel a little awkward for you. So if that doesn't feel good, you can instead have your hands with just your fingers pointing straight up on top of the person's head. I won't keep repeating this, but as with the chair and the self-treatment, we can take our hands off the body in any or all of the positions and treat the energy field, and then come back to touch. Now we move to the third eye, and you can gently roll the person's head to one side, then the other, so you're sort of scooping up the head. And now you are holding the head, you're treating the third eye from the back, and also can be just a nice supportive feeling where the head is being held. If you don't feel comfortable moving the head, or if sometimes I've started and the person's already asleep and I think it's just going to wake them up to move the head, the other alternative I'll show you in a moment. But when you finish this position, just gently sliding your hands out to the sides and the head goes back onto the pillow or the table. Alternative would be to have one hand on the forehead and the other hand on the top of their head. And these, the main positions that I'm describing are in the manual, and I'm also showing you some modifications. From here, we go to the ears, hands cupped over the ears. This is treating the ears and jaw. We have a few different ways we can treat the throat chakra. One is that we can stay seated behind the person, forming a V shape with your hands. And the V is a few inches off the body, not touching the person at all. If you would like to have some touch, but you don't want to touch their actual throat, right? Because that can be invasive, we can let the heel of the hand be touching their cheeks. And the rest of the hands or the finger area is just cupped over their throat. Third option is that you are standing or sitting beside the client. Most people's neck has like a natural curve. So the client doesn't have to move, you just slide one hand under the neck and the other hand is a few inches off the front of the body. So that's the throat. The heart, a few other options. One is that you can just have your hands placed straight across over the top of the chest, like over the clavicle, collarbone area. Second alternative is that you can form a T shape. One part of the T is on the top, the other hand is going over the sternum. So this is something that this one that I'm showing right now, it's not a position that I would use on women, people with breasts. It's just kind of invasive. You will see, if you look at books on Reiki, many of them showing people doing that placement. It may be neutral for some people. I have seen, women practitioners, working together at Reiki Shares doing that. I just feel like it's a little invasive. It's a little too much. So I don't use that one. I usually will use actually the third one that I'm going to show you, which isn't in the booklet. It's kind of like a modification of the first one, is that I stay seated behind the person who's treating their throat. And I'm going to just kind of flip that V out and place it over the top of the chest. So my heels of my hands are like near the collarbones. V is pointing toward the heart, treating the heart chakra. You would just pick one of these three options. You don't have to do all of them. Well, in here, I might also treat the shoulders before coming to the side of the person. You want to be as comfortable as the person receiving the treatment. So you may want to have a chair with you. I may stand for this so that you can see me better, but you're actually giving the treatment. When I'm actually giving the treatment, I usually like to sit. If it starts to feel exhausting to have your hands stretched out, you can put a pillow under your arms just to support your arms so that you're feeling at ease. So the next placement is going to be the solar plexus, like right under the ribs. So many people will lay down just like Dan is, and they place their hands there. So you don't have to move them. You can just put your hands right over the person's hands. For most adults, if you move down about one hand width, you're on the navel. Another way to split up the solar plexus and then the navel rather than doing 1 and 2 is that we can do one side, solar plexus and navel. And then when we come around to the other side of the person's body, we can do the other side of the solar plexus and navel. So now we're going to the sacrum. This is the low abdomen. Again, when we get below the belly button, we're not using touch on the physical body. So my hands are a few inches off the base of the spine here. For the root, I'm forming this V shape with my hands. And the V is going over like what would be sort of like the, I'm just going to come up to the camera. Sorry, it's a bit dark. Forming this V shape, and the V would go over kind of like what would be like the crease in your thighs. Okay, but we're in the energy field. So we're treating the root chakra that way. So now we've moved through all of the chakras. And at this point, we may want to treat arms and legs. There's no specific way to do this. I don't have very long arms, so I usually will treat one arm, one leg, and then walk around to the other side of the table and do the other leg and arm. If it's comfortable for you to reach, you can work parallel. That's another option. No specific way to treat this area. I'll often just kind of walk my way down the body. So I might have shoulder and elbow, upper arm and lower arm, hand, and then come to the leg and do like upper arm, upper leg and lower leg, the knee, the ankle, and then the foot. Just being mindful that people's feet are ticklish, so especially when they're laying on their back, you don't want to have your fingertips tickling the arch of the foot, so you want to just avoid that area, or just use a little bit firmer touch. If we didn't have a massage table and we had a couch, let's say, and this is back here is the back of the couch, rather than climbing over that, I might wait until the client turns over before I treat the other arm and leg. So before the person turns, you'll reattach the face cradle, and most massage tables, this is detachable. It's also adjustable, which is not really important for us because we're just doing light touch. It's important for massage where they're going to be doing some deeper work. So the table has little slots on either end, and we can slide this in, and then it just sort of locks. Okay, make sure that it's locked. And at this point, you can let the person know that they can slowly turn onto their stomach. You're not moving them, but you want to stand nearby so that they don't fall. You just put their face through their face cradle. Okay. So this back part of the body, we start at the shoulders. So very easy to remember this. For most of the back of the body, I'm using this hand placement through the back. So would you like a pillow for your feet?
No.
So we have the top of the shoulders first. Again, each placement, we're going to be there for about 3 minutes. So many times people fall asleep on and off through the table treatment. Most adults, you're going to move about 1 hand width down, and you're at the heart. And then about another hand width, solar plexus. 1 more is navel. Pretty easy to remember. As with the face up, you can also treat one side of solar plexus and navel, and then come over and treat the other side. When we go to treat the sacrum and the root with the person laying on their back, we can form a T shape. And I personally do not use touch. For this one, I stay, 1 hand is over the sacrum, the vertical hand is forming the bottom part of the T. We're treating the sacrum and root. This is another one where some people do feel it's okay. I feel like it's a little too much for most people, because especially it's not like massage. I mean, where our hands are steady here. So I prefer to be in the energy field. I've now treated all of the chakras on the back. And at this point, I could treat arms and legs again. I also could go back to an area that the client requested. So maybe somebody said, please spend more time on my upper back. So I'm going to come back to that area. Treating legs, I will mention, I'm going to try to see if I can move the camera a little bit. I feel like it's easier to treat the feet when the person is laying on their stomach. So place your hands right over their feet. You could do the heels and then the lower part of the foot, whatever feels right for you. Just watching the middle part is a little bit ticklish for most. So as with the chair, we've been doing this treatment for maybe an hour, and the client maybe dozed off or just feels very relaxed, and we want to give him a way to wake up before we finish. So we're going to come back to the top of the head, and we're going to be brushing out using light touch or in the energy field if they didn't want touch. Doing the back, I skip the bum area, it's a little too personal. Legs, I skip the feet because that's kind of ticklish. And I do that at least 3 times. And then I rub the shoulder or tap the top of the person's head to let them know that the treatment is complete. Stay for just a minute.